Hi, my name is Rachel Bonnett. I work in the medical school in the Office of Education Quality Improvement. And about a year ago, I had an opportunity to partner with a now fourth year student, McKayla, who is getting ready for interviews, so she couldn't join us today. But she wanted to teach a session about receiving feedback and giving feedback to the first year medical students. And so we collaborated on creating this session that really focused on the peer relationships that exist in medical school, but was an opportunity to introduce a definition of high quality feedback and just some general principles and tips about how to receive feedback and what to do when you get feedback that isn't very clear. McKayla specifically wanted to have this as a peer-led session so that she could kind of share her personal experiences as a medical student and give those first years a chance to learn from a senior medical student. So she could provide a list of everywhere within her experience where she was giving or receiving feedback to peers or to faculty. And she could really address some of the nuances that peer-to-peer relationships bring to feedback conversations, especially amongst medical students. She also used the session as a chance, like I said, to kind of address what do you do when you get feedback that isn't actionable or very clear, and what are some of those questions and how you can approach follow-up conversations. So we did survey about a third of the class that attended the session, and you can see the majority of students were able to recognize the clinical relevance of needing to learn how to give and receive feedback. We are continuing to adjust this curriculum, continuing to evaluate it. This year, just about a month ago, similar session happened with the first years, but this year we were able to pair it with a small group activity where students were already going to be having the opportunity to give each other feedback about a recorded history taking session that they had done previously. So this was actually, a presentation was given before that. They had a chance to kind of practice giving feedback, talk about what it would be like to hear critical comments about what they did as a large group, and then go practice in their small group setting. So we really are working to instill in the medical learners early on principles of giving high quality feedback and a drive to learn from the feedback that they're given, and just kind of make iterative changes as we go. Thanks.